Okay, so welcome to this yoga therapy session on the hip and lower back release. And because Sasha here has broken her foot and she had to wear boots, her alignment has a little bit shifted, and that results in a little bit of a hip shift, despite the fact that it's the foot that was broken. And if left untreated, that will eventually lead to lower back pain. So this is what we're trying to avoid. And Sasha, bring yourself into Shavasana, please. So have your feet a little bit further apart. Let your feet fall wide. Bring your hands, because you're surrounded by dogs right now, bring your hands onto your belly. And just take a moment to settle into this practice. So just take a really deep breath in and exhale through the mouth. Again, inhale through the nose. Exhale through the mouth. And just give yourself a little bit of time to arrive on the mat. So if you see this here in the studio, I have spread a blanket over the mat because that allows you to glide a little bit better than, because the mat is created to be sticky, you know, and stickiness is not what we're after in the moment. So as you lie on your back with your eyes closed, just become aware of your heels and how your feet fall outwards. And you don't need to correct this in any way, although most people do the moment you bring attention to something. And then become aware of how your calves are lying on the floor, your thighs, your hips. If both hips are the same, or if one hip feels a little bit heavier than the other. And then let your awareness travel up the spine. And become aware of the right side and the left side of the spine. So find out whether the shoulder blades are equally heavy on the floor, or if one shoulder blade is higher than the other. And as you spend this time with your eyes closed and lying on the floor, you will become eventually more aware of things that happen internally. So in the beginning, this is incredibly hard. Become aware of both shoulders. And now, Sasha, you can open your arms into a full Shavasana. Become aware of how both your hands are touching the floor. So nothing is right or wrong here. Just become aware whether both hands touch the floor with the same knuckles. Bring your awareness back to the shoulders and the back of the neck. Become aware if you hold any tension there. Become aware where the back of your head touches the floor. Just become aware of the crown. And become aware of the point between your eyebrows, the tip of your nose, upper lip, lower lip. Take a deep breath in through the nose. Blow out. And then from there, bend your knees so that they're about a hand width away from your buttocks. A little bit further. So no further forward, because that's like, did you see that? That was like a finger. Now we're 3 fingers away. Stop. Okay, that's very good. So if you are home alone, it actually is quite good to start with like just lifting the head and looking, because what happens for most people, especially if like Sasha, you've been wearing a boot, the feet aren't parallel, they're not going to be next to each other. And I want you to bring the feet about hip width apart. And I'm just assisting here. Let me move this dog so that you can see it. And the heel of your foot is parallel to the outside of the mat. And by all means, look up and check this for yourself if this is correct or not. So you don't need to do that because you have me. But if someone practices that by themselves at home, they should have a little look. And interlock your hands behind your head. So we're going to just start from there. And despite this being a hip class, we're going to start with the upper body. So as you next inhale, I'd like you to bring this elbow towards me, so slide as much to the side, and as you exhale, you go back to the center. Do one breath, nothing. And I could see you adjusting, so that's why we do that. Now as your next inhale, move this elbow, and exhale, come back to the center. You can keep your eyes closed, you don't need to look at me. Take one breath doing nothing. And then continue. So as you inhale, slide. And as you exhale, come back to the center. Do one breath without moving. And let's just do a few of those. If you can inhale and exhale through the mouth, then do that. And if that is too difficult, did I say through the mouth, through the nose? Inhale and exhale through the nose, don't listen to me. But you can exhale through the mouth if it's too difficult. And you want to be slow and deliberate. So what I would like you to do next, Sasha, is the next time you slide your elbow up, I want you to actually look at that elbow that's going up. So you open your eyes and look at that elbow, and then as you exhale, you come back into the center. One breath, nothing. As your next inhale, you look at your right elbow or your left, depending on where you are. Exhale, come back into the center. And just continue with that. Now here we're doing this because if you look at this, your brain does some neuro sort of reprogramming by following the movement. But I also would like you to become aware of, now that you're looking at it, you're moving much more jerky. So see if you can move slowly and deliberate. And if this at home is too complicated, just keep doing it with your eyes closed. And become aware whether the elbow rises off the floor or if the elbow can stay all the way down. So there's no right or wrong, just become aware of what happens in your shoulder. We all have a full range of movement when we were born, and as you grow older, very often that range of movement stops here. That would be a frozen shoulder. So because Sasha here has been walking on crutches for so long, she holds a lot of shoulder tension in the moment, but you don't even need to have crutches, you know, it's like typing, you know, sitting at a computer. Most jobs are done bending forward, so like this is really beautiful for the shoulders. Just continue inhaling, looking up, exhaling into the center, and then one breath doing nothing. And one thing that I have noticed is that Sasha's feet have moved. So please bring this foot a little bit forward. Yep, great. Now, at home, I don't want you to worry about that. Please do the next full circle, is your last one. Can't remember which side you started. And when you have completed your cycle, then stretch yourself back out into Shavasana. Shavasana is lying on the floor with your feet hip width apart, your hands at a 45-degree angle, And just give this a little moment to sink in. So just give this the attention it deserves to see whether your shoulders have moved a little bit or relaxed or are still tense. If there has been a little shift in your breath, if there's been any change in the way you are lying on the floor. And then bend your knees again. And this time, Sasha, I want you to tell me if you think that both your feet are, so try and find this by yourself. So like the outside of the foot is on the parallel with the long side of the mat. And both feet are exactly the same width apart. Okay. See, like it becomes incredibly hard if you try and do these things because you concentrate on it. Because after a while, this becomes second nature. You don't even think about it. Okay, so bring your hips straight. Stop that. No, stop. And okay. Don't put too much emphasis on this. I do this here because I am right in front of her. If your foot is like a finger length more, a finger width further forward than the other, that doesn't make any difference. But right now, here, we have the luxury of being precise. Now, your kneecap is here, right? You would find your kneecap here. I can feel them. What I would like you to do is you can either interlock your fingers behind your head, or if that's not really comfortable, just have your arms wide for this particular exercise. I want you to imagine that there is a button just in front. Don't do it yet, because I know that you know what to do, but no one else knows what to do yet. Imagine there's a button about this far away from your patella, your kneecap. Keeping the foot locked into the ground, I just invite you to now touch that button with your kneecap. Good. And then bring the knee back. And then we're going to do one breath, nothing, because otherwise we become very fast. And then you move the other leg forward and touch the button and touch it back. And then you do one breath doing nothing. Now I'm going to keep my hands here just for one round. And I would like you to do this on your inhale. So as you inhale, you move, touch the button. As you exhale, you go back. One breath of doing nothing. And inhale, other knee touches the button. And return back. Okay. So continue with that. Just very gently, as you inhale, you touch the button about an inch in front of your knee, the imaginary button, obviously. And as you exhale, you return back to neutral. So this is a tiny knee movement. The feet are grounded on the floor, but not pressing. You're not having any weight on them. You're just resting on the floor. And what you will notice with this micro movement that you're doing, you are actually introducing a hip shift. So moving that knee downwards brings the whole side of the hip with it. And as you exhale, it returns back to neutral. And you don't need to do it super fast. So just keep it small and simple. Something very easy you can do with your exhale. So Sasha, you're moving a little bit too much. So if I just have my hand to the other knee. Yeah, that's enough. And then exhale back to the center. I would also encourage you at home, if you don't listen to this with headphones, to have some music on. I will have music playing over this, but if you start doing this on your own, because you don't always need to follow me talking. This is a really nice thing to do with some solfeggio frequencies, like healing frequencies, like a 5 to 8 frequency perhaps, or just some very slow chill out music, or a mantra, perhaps the Gayatri mantra. I will post some example playlists below this video if you're in the Holistic Live Lab group. And if you're watching this on YouTube, you can always join the group, so and then you get the full benefit of everything. So as you inhale, one knee shifts. Exhale to the center, one breath doing nothing, and then the other side. And from here, I want you to complete one more full round. So if you're halfway through the round, you just do one more knee. And if you have just completed a round, you do both knees. And then you come back into Shavasana. And now we're going to combine these two movements. So, see if you can find it yourself now. So you bend both your knees. You know how to find the distance. Excellent. And then you interlock your hands behind your head. So we're going to do the same movements, both movements combined. So I'm going to start on the left-hand side simply because I am sitting here and I can help her. It doesn't matter whether you prefer to start left or right, you know, just go for it. So combining the two is like, as you inhale, don't do the knee yet, you slide that elbow up. So let's just try that once. So you slide the elbow up and you bring your nose towards that elbow. Good. And then as you exhale, you come back into the center. Now for demonstration purposes, she's going to do the same arm again. So as you inhale, you slide up. So start sliding, and now you start sliding that knee and touch. Okay. And then as you exhale, you go back into the center. Bring the knee back. One breath doing nothing. So inhale and exhale. Now the right hand side, and touch the button. And as you exhale, you return into the center, and you just continue, and you have one breath doing nothing. So the reason we do it, it's normal that you try and do them opposite the movements, the opposite knee, then the elbow that goes up. We're not doing that. The reason we're doing it this way around is that when you bring your elbow up, you really stretch out the side. And when you bring that knee forward, your hip shifts forward. And then you return back to the center, and you have one breath of doing nothing, and then you do the other side. So because these are these tiny micro movements, you experience a stretch and a balance, a stretch and a balance, and over time you have the opportunity, or your hips have the opportunities to reset themselves into a balanced position. And it's the same with the shoulders and the arms. And with Sasha here, I very often see a nervous system release where she yawns a lot. It's not so much in this session, but very often when you start doing this work, you will find that you have this overwhelming need to yawn. So it's completely normal. Just go for it. So as you inhale, you bring one arm up, One elbow up and the same knee presses the button. As you exhale, you return into the center, and then you do the same on the other side. Inhaling. I forgot to say that you have one breath doing nothing. Exhaling. And then the other side. So the knee that's pressing the invisible button is the same knee than the elbow that is up in the sky. This can be very confusing to start with. So just keep the movement, inhaling, exhaling, and the other side. And there was the nervous system release. Yeah, we're filming this in the afternoon after a good night's sleep. It's just something, not that we slept until lunchtime, but we both had a good night's sleep. It's early afternoon. You know, the yawning is a nervous system release, so it's actually a good thing. And it takes a while for you to get into the rhythm. Try inhaling and exhaling at the same rate. It's taken this long to get the dogs to find a spot where they're relaxed. Let's say complete 2 more complete rounds. Stretching and releasing with these micro movements. And then after the next round, you return into Shavasana. Shavasana is the corpse posture where you basically just lie on your mat, feet stretched out, hip width apart. Let's let the feet roll outwards. So it's time for Shavasana for Sasha as well. Arms about 45 degrees away from the body, palms facing upwards. We're doing that so that you don't touch the floor with your fingertips, which gets your thoughts in motion. And just become aware of how the body has responded to these very slow movements over time. Okay, so from here we're going to do a spinal release. Bend your knees again into the same position, about hip width apart, about hand length away from the buttocks, outer side of the feet parallel to the outer side of the mat, not the map. And then bring your arms into a cactus. So this is the cactus. If this is not comfortable for you, have the cactus wider or have them even like this or even like this, okay? But in Sasha's case, she has full range of movement, so that's what we're gonna do. So what we will do is, as we inhale, you will arch your spine. And as you exhale, you bring it back down, and you very gently press the spine into the floor, just very gently. So just make it really straight. And again, as you inhale, you arch, and as you exhale, you very gently flatten it. And you want it to arch quite strongly, so you can see my hand coming through there. And then I invite you to do this with your breath, and slowly. So as you inhale, you arch your spine. And as you exhale, you gently press it into the floor. And this is the movement. We're not going to do much more. So as you continue with this, just become aware of the spine itself and visualize all your vertebrae. And just have a feeling that you can see them moving vertebra for vertebra into the floor as you lengthen it and press it into the floor. And if that makes you feel uncomfortable, you don't do that visualization. I know that some people don't like it to turn inward anatomically. So just feel yourself arching and flattening and feel it like a fluid movement. Now, as you do this movement, you will find that your neck is very gently doing the exact opposite of what you're doing at the lower spine, because our spine is curved, and it's curved so that it's shock absorbent as we walk. So this S shape allows us to move fluidly. So if you arch your lower spine, the upper spine naturally comes down a little bit. So it lengthens. And as you flatten the lower spine, and you can tell this like your chin is going sort of more up in the air. So I invite you now to make this a little bit more deliberate. So as you arch, you bring your chin a little bit closer to the collarbone as you normally would. And as you flatten, you bring that chin a little bit higher into the sky as you normally would. And just continue these tiny, tiny movements. And of course, another thing that happens naturally as you're arching your spine is your hip. The whole hip basin is moving forward and backwards and forwards and backwards. And because it doesn't need to carry anything, this is just a beautiful release. I just invite you now to just inhale and exhale for another minute or so. I'm just going to let the music play over this. into a neutral position. And hug your knees into your chest before you come into Shavasana. So just hug your knees. You may gently rock from side to side. And bring yourself into another little mini Shavasana. Careful, there's a dog. Alright, let me move this dog into a slightly different position. Those of you who don't have a dog, that's quite lucky in this instant. And just feel how the feet are touching the ground, how the back of the calves, the knees, the hips, the spine, the shoulder blades, the shoulders, the elbows, and the knuckles of the fingers, and the back of the head are now touching the ground. And then we're just going to do one more short movement, and I don't want to do too much because this has already been a little bit longer, but I feel that you need this time in order to release something. So this is not really work that can be done in 5 minutes. The following twist we will also do in a different video and we're going to elaborate on it a little bit. And for now, I'm just going to move a little bit out of the way. And Sasha is bending her knees again. Have them about hip width apart as before. This time, I invite you to cross your right knee over the left. And just bring the arms wide. A little bit wider. Good. No, that was good. So now as you inhale, the knee that is on top pulls the other knee all the way down. And as you exhale, you come back into the center. And that's all we're going to do for now. This is also something I would normally do in stages, but because this is the final movement in this sequence, as you inhale, you pull it down. We're just going to do this as a final release, and so that we get a little kind of twist in. And really what you want to achieve is that this side of the spine where I am sitting is getting a really deep stretch. So that knee should almost go down onto the floor. Perhaps it even goes down to the floor. And perhaps it even points to the wall opposite the head. And make sure that this is about the breath and not about the end posture. So the movement is the journey and the goal. So as you move, you inhale, and as you return, you exhale. And just do a couple of more. Resisting to stay in that end stretch for too long, just circular breath as you return. And then just unfold your legs, come into a tiny mini Shavasana just to adjust yourself, making sure that you're straight, bringing your arms at a 45-degree angle. Become aware if the left side and the right side feel different in any way. Become aware of any gifts of deep sighs or yawns or other adjustments. then bend the knees again. Find your balance and turn the legs over, arms wide. And start into the opposite direction. So as you inhale, the top knee pulls the other knee kind of down. It pulls it with it, but if you have full range of hip movement, that lower knee goes towards the wall opposite the head. And you're really lengthening your spine. Just make sure that the movement is the journey. It's not the goal of the stretch. We always try to go to the extreme and hold that. It's a very human thing to do. Excellent. And then just do a couple of rounds more. Get yourself into Shavasana. Into Shavasana, hands by your side, or in this case you can bring them on your belly, one on your belly, on your chest, whichever you prefer. And if you're in a gym, in a yoga studio, in a gym, very often this is where people just like jump up, grab their phones and leave. I invite you to stay in Shavasana for a few minutes, because what happens now is your body takes this moment of stillness and integrates the movements into the body's memory. And so this little sequence of movements is very gentle, very slow. It works on repetition. The idea is to reset and remember that despite the fact that I said Sasha had broken her foot, she'd broken the cuboid bone, which is the one in the center, just below the metatarsals, and just show a little picture. We didn't work with the cuboid bone at all in this moment, or in this instance. We just worked with the hip and the spine and the shoulder alignment to make sure that when that boot is coming off and the crutches are out of her life, that she will readjust faster into a normal state of balance. And with that, if you have time, stay for another couple of minutes longer, and if not, sit up slowly, drink a glass of water. Thank you for practicing with me. Namaste.